What are the uncommon symptoms of menopause that we don't talk about?
So the uncommon symptoms, so I'll start off with the common. Hot flashes, night sweats, brain fog. Those are like the three common things that people think that it's menopause related, and typically it is. More headaches, dryness, like your skin gets dry, and that's because you start producing as much collagen, your skin gets thin, and it gets dry. Frequent urination, so you think that you have a UTI and you're running to the bathroom constantly. Bloating, more belly weight, restless leg, joint pain. Frozen shoulder is one of them. Joint pain in the small joints too, but frozen shoulder is like one of the big ones. It's not sleeping well, brain fog, smaller breast, vaginal itching. What are some of the other ones that I was looking through? Dry eye, palpitations, hair loss. I mean, there's like a whole gamut of them.
Can women benefit from testosterone?
Yes. So it is little known that women make testosterone, actually. We make it in our reproductive years. And some of the classes I've taken, some of the professors say that women make more testosterone than estrogen in their reproductive years. And so testosterone is very beneficial, not only for like muscle health. I like it for muscle health because when you are able to increase your muscle, benefits your bones because it strengthens your bones, and we know resistance training strengthens your bones. But that synergistically with estrogen strengthens your bones as well, and it prevents further bone loss. So I think it can be great for that. I also think that it just helps with energy, helps with libido. And so, you know, but testosterone is not for everybody either. If there's a patient that has like PCOS, they're typically androgen or testosterone. They have a lot of it, they make a lot of it, so they're not a person that would really kind of give testosterone to. It's really more of like a judicial decision at that point, but it can be very beneficial for the other things that I described.